The Black-Lockett-Scarbrough Fund was established to provide assistance to all patients in the Columbus, Georgia and surrounding areas, regardless of where they receive their dialysis treatment. The fund was named in honor of 3 dialysis nurses and unites all dialysis providers in the area for a common goal of showing honor to those nurses we've lost, care to the patients in need, and service to the dialysis community. This is the legacy of Kay Black, Jerry Lockett, and Chuck Scarbrough.
The Black-Lockett-Scarbrough Fund honors Kay by giving patients the things that they need when they can't get them anywhere else. And I think that Kay, with her dedication that she had to her job and the way she loved dialysis, is just a really good way to honor her memory.
I think it honors Jerry because it touches everyday people with everyday needs. And that's what Jerry was most sensitive about, is what's going on with his patients now. How can I help? He would give his last dollar to whatever mankind needs were.
Well, Chuck was a nurse that definitely didn't just, take his job just as a job. He worried about the patients, he worried about their well-being, and he truly felt their needs outside of just dialysis, and he knew the struggles that our patients go through financially, emotionally, and sometimes their needs don't get met. So I really, when this came about, I couldn't think of any way to best honor him and for his good works to continue is to name this fund after him.
I'm Susan, I work for DCI, and I'm part of the team that helped put together the Black-Lockett-Scarbrough Patient Fund. There's a huge disconnect, I think, between people who have never had to do without or have never suffered any hardship, and then a lot of our patients. They've been, I've seen financial forms where patients only have $600 a month coming in, and sure, there's Medicare and there's Medicaid that take care of a lot of the basics, but a lot of things are neglected, and things that we take for granted, like if I have a toothache, I can go to the dentist and have it taken care of, or if my medicine copay is $50, I just write a check. But these are huge amounts to some of these patients, and it's hard for them to meet those needs, and this fund can help do that. And not only improve their quality of life, but even help with their quality of care.
Starting dialysis has really changed my life. I was working on my job for 15 years. And on August the 28th, I got real sick at work. And I went to the emergency room. And then I had to come see Dr. White. And around about September the 6th, he told me I had to start dialysis. So it was real hard on me. And then while I was on leave or absent from being sick, my job shut down. So once my job shut down, my income, my short-term disability stopped. So I had no money to depend on, and I had a house note and a car note. So in that meantime, I was getting behind on all my bills, and I had got like 3 months behind on my mortgage. So then I went to the social worker, and I would ask her, was there any way I could get any help? And so I filled the paperwork out to get help, and we called my mortgage lender and asked her would she work with me while I wait on my Social Security to start. So she said yes, so I filled the paperwork out to get the funds, and they paid a month of my mortgage. So that was, I was able to save my house. So it helped me out a whole lot.
When I broke my dentures, I knew I had already gone a month or two without it. But when I learned about the fund, I checked into it, asked about it, and did the preliminary paperwork to get it to do what I needed to do, and it was on time.
The fund helped me to be able to get my Nepro, to keep my energy up and keep my blood sugar level. Because I have hypoglycemia, and that's low blood sugar, and that Nepro helps me to keep it up so I won't come up here and pass out. The fund is a good fund. It'll help you where you're not able to pay for things that you were able to pay for before you got sick, and now that you're on Social Security, you're not able to pay for it, but this fund will come in and help you.
It has helped me sometimes words can't express what it has done, to be able to smile again, because I had broke my dentures pieces. You may not believe that, but when I actually walk down those halls, going to whatever part I'm in, and since I had my dentures, I just feel her spirit, and I say it has to been the right thing to do.
As a social worker, you're always looking for resources within the community to pull from for assistance for your patients. So having the Black-Lockett-Scarbrough Fund available in our community has been wonderful. It's a specific fund for dialysis patients that we can pull from as renal professionals to help with our specific patient needs. Some specific examples of how patients at my clinic in Phoenix City, how these patients have used the fund is I've had a couple patients who have been able to have dental examinations, receive dental care, whether that's dentures or teeth extractions. I've had a couple of patients who have had been able to have eye exams and get eyeglasses, and we have had several patients who have been able to receive nutritional supplements through the BLS Fund. With dialysis patients, we all know how important the albumin is and the nutritional status, and while there are other funds available, even kidney organizations, often those funds are depleted. So it's been a great resource to have Black-Lockett-Scarbrough available to our community to use when other funds or other community resources or health insurance programs are not available or do not provide for the needs of our patients.
The patients are very appreciative because they're at the lowest point in their life. They've started dialysis, they may have financial challenges, and they may be, they're afraid. And so they are at a point that they really appreciate anything that is done for them.
I think mostly what I see is the stress and worry kind of start to disappear. When people need something and think there's no way of getting it, that causes a lot of anxiety. And I think having the resources to help with those things that Medicare and Medicaid doesn't cover, it's a sense of relief.
The BLS Fund is really important for our patients because there's a huge gap between what insurance pays and Medicare pays, and then on a personal level, some of the needs that don't get met, and some of our patients just go without getting some of those things. And this is a way to me to bridge the gap and to go beyond just their dialysis needs. And I really think that we can better take care of them when we can meet all their needs.
I would say that anyone who wants to consider doing some good for the dialysis patients should really consider giving something to this fund, no matter how large or no matter how small. 100% of all of the proceeds go directly back to the patients. There's no overhead, there's no paid consultants, no marketing at all. So every dollar that's raised, even if it's just a few dollars, goes directly to a patient in need.
Through fundraising efforts and your generous donations, the Black-Lockett-Scarbrough Fund is available to assist dialysis patients in the community.
Please give. It helps. Every little bit helps.
Please give. We need this fund.
This is your chance to give as a community.
Please donate to the Black-Lockett-Scarbrough Fund.
Please give.
Please give generously.
Please give to the BLS Fund. This is a very important fund that helps all of our dialysis patients.
Please give. And if I had my money today, I would pass and give it with all the love I could give.
Please give.